Welcome back to Wave 3 Listens. John Ramsey here along with Dr. Sean McGuire, the Physician Center for Beauty. And no question about it, Doctor, we have the most beautiful, the most youthful viewers in all of Kentuckiana. But they do have some questions for you. Sandy is with us. Sandy, good afternoon. Welcome to the show. Hello, Sandy. Go ahead. Sandy. We may have lost Sandy.
Hello.
Hello. There you are. Hi, Sandy. Go ahead.
Yes, I would like to know, I hear reports there, all plastic surgeon talks about people in their 40s or 30s, 40s or 50s. What about people in their 70s? Is Botox good for people in their 70s? And if so, does it last for how long?
Okay, that's a good question. I have a number of patients that are in their 70s that do Botox and some of the other less invasive procedures like dermal fillers, and it works very well. Botox is primarily for the upper part of the face, so around the eyes, the crow's feet, also the forehead, and those lines between the brows, we call the 11 lines, and it works very well for those areas. And it works equally well for patients that are in their 70s or patients that are in their 40s. And typically Botox or Dysport, which we're going to talk a little bit about later, lasts between 3 and 4 months. So it's something that typically people do on an ongoing basis. And, you know, if someone wants to do it and doesn't want to continue to do it, that's fine. It doesn't make things worse. Things just kind of gradually go back to where they were. But whether someone's in their 40s or in their 70s, it works about the same amount of time.
From what I understand, Dr. McGuire, too, if you do Dysport or Botox on a regular basis, it will tend to last longer than maybe someone who's doing it for the first time.
That's true to a certain extent. Over time, I think if we're not using those muscles that are creating those wrinkles, if we're not using any muscle, they weaken a bit. So I think it does last longer over time as people continue to use it.
All right, let's grab another phone call. Questions coming from Catherine. Catherine, good afternoon on this beautiful day. Welcome to the show.
Thank you so much. My question concerns the under eye area. Not swelling or puffiness or darkness, but almost more of a sunken look. And I'm wondering if there's a product or a procedure that sort of plumps that area, and are there any reasons not to do a procedure like that?
Is that for the under eye area? Is that what you mentioned? Yeah, that's a great question. That is actually becoming more and more common, and I do treat that area a lot with dermal fillers typically. So you pointed out something that we see as we get, particularly for thin faces, as we age, we lose volume in the cheeks and the upper face and around the eyes, and we lose soft tissue and fat. And that can age us, particularly in someone that has a thinner face or a longer face. So adding volume to that area with dermal fillers is something that I commonly do in the office. It's become more and more popular, and I really enjoy doing it because it can make a huge difference for those people that have that sunken look. And it can also make the eyes look better for those people that have some bags, but really the issue oftentimes is that they're sunken and have lost volume underneath the eyes. So that's something that I frequently do with fillers, and it works very well. And fillers in that area, fillers like Restylane, for example, what I typically use for that area, lasts a long time. They last a lot longer than anywhere else on the face that we use them. So typically, a year and a half to 2 years duration in that area.
Wow.
So it's pretty remarkable, and it works very well.
Maybe one of the few times, Dr. McGuire, that the word plump is good.
No, and we think of, we traditionally think of, skinny is good.
Right.
And maybe that's true, but I think in the face,
youthful.
A loss of volume in the face can really age us and make us look drawn and tired, and so we can correct that with fillers.
That's why they call it a baby face, right?
That's right.
There we go. All right, we're going to talk plastic surgery. We're going to take a look at some of the work of Dr. McGuire. Before and after pictures, Dr. McGuire, I'll let you do the play-by-play here, and I love looking at these because then you're going to see the drastic, remarkable difference. I've seen this young lady before, but you can't say it enough. Look, she is 15 years younger.
Well, I think she looks better. I mean, she certainly looks healthier. She looks rejuvenated, she looks more rested, and she does look younger. And we address the neck and lower face with a lower face and neck lift. We also We also did a treatment for her nose, so it's kind of a refinement of the tip of the nose, and treated her brows and upper eyelids. So I think you can see some nice improvements there. This is a huge difference in terms of the neck for this patient. Actually, this was liposuction of the neck, and it's remarkable how much skin tightening we can sometimes get. Not for everyone, but for those people that have pretty good quality skin, we can get a lot of skin tightening oftentimes with just liposuction, which is a fairly minimal procedure. It's less involved than certainly than a facelift, something that's done as an outpatient. And
the neck is really a teller, isn't it?
It is. I mean, most patients that come in with concerns about aging of the face, it's really the neck and the lower face that most people are most concerned about.
Wow. Look at some of these pictures. Once again, Physician Center for Beauty. The number is at the bottom of the screen, whether it be plastic surgery or some of the other procedures here. Doc?
Yep. Again, the amount of skin tightening that we're able to achieve for certain patients with liposuction can be pretty significant. And you can see a frontal view there. We did not do a facelift or neck lift per se on this patient, but that was liposuction. This patient actually did have a lower face and neck lift, so a little bit more involved procedure. We also did an upper eyelid lift, or what's called blepharoplasty, and I think she looks refreshed, looks more youthful, and I think certainly looks natural. This patient, we did a lower face and neck lift, and I think you can see a nice improvement in her neck and jawline there as well.
Yeah, I think what your expertise is, Dr. McGuire, because it's subtle. It's an art for you. It is a natural look. You won't look at someone and go, wow, what happened? You'll say, wow, you look refreshed.
Right.
You look younger. You look rested.
And that's the idea. I mean, I think most people want to look better. They don't want to look different.
I agree.
This is another example of work that I've done. This is the upper eyelid or blepharoplasty surgery. Really just looks, more refreshed and a bit more youthful.
Wow. Cutting-edge research here. Doc, your eyes. Now, that is something, you really have to be an artist when it comes to eyes.
Well, yeah, thank you. The upper eyelid procedure is really pretty straightforward, to be honest with you. It is done as an outpatient. There's pretty minimal pain and recovery and downtime from that. The lower eyelid surgery, likewise, this is an example of a rhinoplasty or nose that I did, and I think what's interesting to see here, we also did some liposuction of the neck. It almost looks like in that photo that she had a chin implant. She did not.
But I think you reduced the nose.
We reduced the nose, and we also addressed the neck and improved the contours of the neck. So I think she just looks in better proportion and more balanced.
All righty, now we're going to take a look at some tummy tucks here, if we would. Tummy tucks, okay. Now, Doc, tummy tucks. Is this someone, this would not be a patient that is obese, just someone who perhaps has just a little bit of an issue with their tummy?
Right. So, for those people that, particularly women that have had some children that have some laxity of skin, some excess skin, and some fat, this is not a treatment for obesity, certainly. For those people that need to lose a significant amount of weight, that needs to be addressed first before considering abdominoplasty or tummy tuck. But you can see a nice improvement here in the contours, addressing the fat and excess skin, and some stretch marks as well.
All righty. Beautiful work. Dr. Sean McGuire, again, we're located on the Shelbyville Plaza. One more look here at the tummy tuck.
Yep.
Wow, look at the difference there, Doc.
Yep. So, and that incision, that scar, heals very well. That particular patient, that photo was taken at 3 months, so that scar fades and continues to fade over time. And we try to keep that scar, that incision, low so that it's well hidden in a bikini line. Another example of a tummy tuck that we were able to do, she had a significant scar from a previous gallbladder surgery. We were able to get rid of that, also able to get rid of the excess and tighten the skin and improve the appearance of the belly button as well.
All right. If you're thinking about any of these procedures or any of the procedures that we'll be talking about, give them a call, Physician Center for Beauty. One more quick look here, Doc, if you would.
Yeah, so that's a good example of an abdominoplasty or tummy tuck that we did with a significant scar, vertical scar underneath the belly button. We were able to get that out as well as tighten the skin, improve the contours of the abdomen as well. All
right. You see the expertise of Dr. Sean McGuire. He's an artist. He's a plastic surgeon. And coming up, we're going to talk about dermal needling. What exactly is dermal needling? How can it make you look more youthful? Physician Center for Beauty. We'll be right back on Wave 3 Listens.